Our next guest is Dr. Josef Mueksch, an anesthesiologist with Novant Health Brunswick Medical Center. Dr. Mueksch, welcome to the show today.
Thank you.
Great to have you here. And I know that some of our viewers out there probably would like to know a little bit more about you. So let's start by talking about your experiences and a little bit about your background.
Okay. Well, I grew up in Birmingham, Alabama. Managed to escape and get up to Philadelphia for all of my secondary education. So sorry to my UNC fans, but I went to Villanova for undergraduate, stayed up there for medical school, residency, and then worked actually in downtown Philadelphia for 6 more years before I came down here in 2010. Been down here for the last 7 years. Don't foresee myself going anywhere else in the near future.
No, that's great. It is lovely here. It's just a great place to live. And I understand that you're an anesthesiologist with Providence Anesthesiology Associates. Is that correct? That is a mouthful, Joey.
It is a mouthful. We like to abbreviate it PAA. It's a lot more simpler.
Well, from here on out, it will be PAA.
Yeah.
So tell me a little bit more about the group.
We're a physician-owned and run group of about 70 anesthesiologists across Virginia, North Carolina, and South Carolina. We have a partnership with most of the Novant facilities. So the group itself is actually based out of Charlotte, but we have docs all across the state and been a part of them for about the last 4 years.
But that doesn't mean that you guys travel to all the hospitals. You're primarily based here.
Correct. No, my home base is the Coastal Division,
right.
But we're just part of the large group that
Yeah.
is associated across the Novant facilities.
Right, yeah. So your group provides all the anesthesia services then to Novant Health Brunswick Medical Center, correct?
Correct. There are 4 doctors stationed down here at the Coastal Division down in Brunswick. We're all members of the PAA group, or Providence Anesthesia Associates. But we provide all the services from surgeries, epidurals, any other procedures that may need to be performed at Brunswick.
Well, our goal today is to help our viewers learn a little bit more about anesthesia and the many advances that I'm sure have been made in the last several years. So let's start with the most basic question, which is, what exactly is anesthesia?
Right. It's a very common question that I get from a lot of people. In its simplest form, anesthesia is just the loss of sensation and awareness. People view it as, I'm coming in for surgery, I'm going to go to sleep. But there's a lot more involved to it than just sleep. Kind of the easy way I explain it to people is I have 4 main goals I'm looking for with anesthesia, which would be, analgesia or pain control,
right?
Unconsciousness, asleep.
Yeah.
It's a good thing. Amnesia, meaning you don't remember what happened.
I like that one. Yeah.
And then relaxation, meaning you'll stay still during surgery. You'll relax. So anesthesia is a combination of any of those 4 things. But to the patients, really, you go to sleep, you wake up, and it's done. And that's usually all they want to hear is, I'm going to sleep through everything, correct? But it's more than just sleep.
That's what I always say. No, I'm not going to feel anything, and I'm just going to sleep through the whole thing, right?
Everything else I don't want to know, Doc. I want to be asleep.
I don't want to know about that. Well, that's really interesting. Well, let's talk about the different types of anesthesia and under some of the circumstances that they might be used.
So we tend to break anesthesia down into 3 main groups, shall we say. So the old-fashioned, you're completely asleep, you don't remember anything, do anything, we call general anesthesia. Now, general anesthesia just means that you're unconscious and you're out, you don't know what's going on. We can just give you sedation where you may or may not have some fuzzy memory. Or there's also ways that we can make certain parts of your body turn off and go to sleep. Like epidurals, women having babies, they're awake, but they're under anesthesia because we've turned off the sensations that they're having. We call that regional anesthesia. So those are the 3 main types of anesthesia. Now there can be overlap, so just because you're having surgery doesn't mean I'm only getting one of these. You may get all of them. So a lot of people come in for knee replacements.
Right.
We make their knee go to sleep or numb so they don't feel it, but we'll also put them to sleep because they don't want to be awake or helping the surgeon while they're performing the operation.
Oh, I think that'd be kind of cool to watch.
It can happen if that's what you prefer.
Yeah, I don't know. They use hammers and stuff there,
Hammers, saws, drills.
Yeah, I don't know that I want to see that. Well, okay, for Patients who will have surgery that does require anesthesia, what are the typical steps that the anesthesia team would take? What would we experience?
That's actually one of the newer advances in anesthesia in more recent years. Is something we call the perioperative surgical home. So obviously you visit your surgeon.
Yeah.
They schedule the surgery, and then what kind of happens? You show up the day of surgery.
Yeah.
So we've kind of taken control over a lot of that preoperative care.
Nice.
As far as preoperative scheduling, visitation, lab work, all that. We found that patients tend to do better. We tend to eliminate or decrease cost. So that's what happens behind the scenes, shall we say, in the days to weeks leading up to your surgery. Obviously, the morning of, you kind of got to come in a little bit grumpy, a little scared. Nobody gets to eat, nobody gets to drink, so everybody comes in a little grumpy. And just nervous, not knowing what's going to happen the morning of.
Right.
At that point, then we obviously take them into the surgical suite. The operation happens, and then hopefully they wake up quickly, comfortably, and then get to go home, enjoy, shall we say, the rest of their day.
Well, after surgery and after the anesthesia, what might we expect to experience? Would we be sick? Will we wake up fast?
Right.
How do we feel?
In an ideal world, obviously, we'd be able to snap our fingers,
Yeah,
and patients would, be able to wake up and go home. Kind of the old adage is less is more, but sometimes for bigger surgeries, you need a fair amount of medicine to put you to sleep. And there are, I don't want to say risks that are associated with that, but there are side effects of medicines, one of the most common ones being nausea and vomiting. We try and do everything we can to stop that, but we don't always win. The other big thing that you'd expect from anesthesia, not necessarily from the anesthesia itself, is just you're having surgery, so there's going to be some discomfort.
Pain. Yeah.
Because of that, you'll need pain medicine and some of the lingering effects of the anesthesia and the pain medicine that has the benefit of leaving you a little bit groggy and sleepy, but also leaves you a little bit groggy and sleepy, so you don't bounce or snap right back.
How about risks? Talk to me a little bit about risks of anesthesia.
Well, obviously we already just touched on nausea and vomiting, which is a very common side effect associated with.
I don't think that's so bad.
Right. But obviously the big risk everybody is always
Yeah.
afraid of when they come in is, am I going to wake
up?
Right, and that's the one question we always get. Backtracking, anesthesia, in the 40s, 50s, 60s, when I was a little kid, was the risk of passing away was about 1 in 10,000.
Wow.
To now it's about 1 in 250 to 1 in 1 million.
Wow.
So
Huge difference.
and that's taking all comers, obviously, depending on, if you're having heart surgery, brain surgery, your risk factors coming in. But it's a lot safer. What I always tell patients, and usually their spouses, you're a lot safer in my hands than you are riding with your spouse on the way home.
Well, that's great information. And finally, do you have any words of advice for those of us who may be going to have surgery in terms of anesthesia? Any words of advice?
Biggest thing I tell patients when they ask me about anesthesia is, one, follow directions. So when you tell you not to eat or drink, please don't eat or drink anything. But anesthesia is very individualized. We're going to ask you a lot of questions, and feel free to ask us a lot of questions. Because, everything really is going to be tailor-made for you. And we want to provide the best care possibly for you.
Great. Well, thank you so much for being here today. It's
My
been
pleasure.
very informative. We always love to see you, and we hope to see you again real soon.
Well, thank you.
Except, no, I don't want to have surgery. So
That's right.
I'd
See
rather
me
you
here.
be here.
That's right.
Okay, thanks, Joe.
Thank you.